I've been working on this behind the scenes. I've never formally filed anything just because I think I want to make sure that I have something that can get passed and get done in the state legislature. So I've talked to my colleagues, I think to all of them. I think they're all tired of hearing from me about these issues. The one thing, even from the opponents of the bill, that they agreed on was that things that, public buildings of any type, so whether it be courthouses or government buildings, schools, which are public schools also, should be, smoke-free areas. And they agree that those are public dollars, should be funding them. We can do it there. They just don't want to see private industry be restricted. So I think that's low-hanging fruit. I think unless I get some opposition for that, I would think making our school campuses, smoke-free, all elementary, junior high, high school, even our university campuses, and make all of our government buildings smoke-free would be something we can get done. We can all agree on. The private debate we can continue to have going forward, and I'm hoping that the Smoke-Free Coalition continues to work on local communities to get them to voluntarily do that. But I would think there is resistance from some school boards, from superintendents, from letting our schools be smoke-free, which I think should be a place that our kids shouldn't have to go to school and inhale that.
Now, in terms of other 2017 legislation, more and more of these committee meetings are about medical marijuana.
Yeah.
So what kind of legislation do you expect to see in 2017? And do you think it's going to get done this year, or it's going to be a longer process?
Yeah, it's still, the issue is still a federal crime. And that's the problem, is the federal law is still, if you get an attorney general who wants to go after people, we could put our own citizens to reassure them that, hey, the state won't do anything, but the feds could put you away and put you away for a long time on it. And there's so much funding that comes from federal dollars too. So any hospital system is not going to permit you to do that, even if the state says it's okay, because they rely on federal dollars. Hospice and that kind of thing, all of them are included in that. So it's a very touchy issue. As a physician, I'm open-minded to it, and the definition of what medical marijuana is the big debate, because some say medical marijuana, they talk about smoking a joint and growing your own pot in the backyard and smoking it. I would be opposed to something like that, just like I don't think people should smoke opium. You get morphine from the doctor, but you don't smoke your own opium. The same thing with marijuana issues. Now, if you're talking about using inhalers, or if you're talking about using pills that are prepared as a medication form, of course, if they have benefit medically, I think doctors are always open to that. But the debate is we need more research. The American Medical Association, the Kentucky Medical Association, the National Multiple Sclerosis Foundation, all of them are saying we need more research on this issue, and we don't have really good science to prove that it works. Marijuana may work in certain medical conditions and not in others. So just because it helps somebody's nausea in one case, I've got patients that have that smoke marijuana routinely and have something called hyperemesis syndrome, where it causes their nausea and they have to get admitted to the hospital. So there's negatives to it. It depends on the individual. I think it's had some hope in treating neuropathies, things like multiple sclerosis or peripheral neuropathies. Probably some people do get benefit for anxiety treatment, PTSD, and some of those things, but it's all subjective. And we're going to have to just do double-blinded, placebo-controlled, studies that are massive to prove that it works in population management. Once you have that behind you, then I think it's going to be easier for the AMA and the KMA and other medical associations to put pressure on government to say we need to get this stuff done. And that's where the push needs to be. The feds just restricted it still to a Schedule I drug, so they didn't move it where you can prescribe it. But they have pushed it now to allow more research in our universities. So hopefully more schools will start to study it. And if they find that it works, then maybe we'll have some push to allow it in certain medical settings. So I think it's still evolving. I think everyone's looking to the medical community, and we have to be scientific about the approach.